Ever wonder what really keeps you safe in a hospital? It's not just the high-tech gadgets or the fancy machines. Today, we're going to dig into these simple yet incredibly powerful unseen actions that are the true pillars of patient safety. We think of hospitals as these places for healing, right? But what's the secret ingredient that makes them safe? It actually goes a lot deeper than the shiny equipment or the famous surgeons. It's something way more fundamental. And the answer? Well, it lies in these unseen pillars of care. These are the basic, disciplined actions that are performed with total precision day in and day out, and they're what protect every single one of us. Okay, so let's jump into our first, and you could argue maybe the most critical pillar, the absolute first line of defense against all those invisible threats that can be lurking in any healthcare setting. And that first line of defense is something we've all heard of: hand hygiene. But listen, this is way more than just a quick rinse in the sink. It's a precise, scientific process. It's basically any procedure that's designed to stop the spread of harmful germs. To put it simply, it's all about breaking that chain of infection before it even has a chance to start. And this isn't some random wash when you feel like it kind of thing. No way. It's a highly structured system built around 5 critical moments: before you touch a patient, before any clean procedure, after you've been exposed to fluids, after touching the patient, and after touching their surroundings. Each of these moments is a doorway for infection to spread, and this system is designed to slam that door shut. The technique itself is just as precise. We're talking way, way beyond just rubbing some soap around. Just look at these steps: palm to palm, palm over the back of the other hand, fingers laced together, backs of the fingers, thumbs, and finally the fingertips. Every single step is meticulously designed to clean every little surface. It's like a life-saving dance that gets performed hundreds of times a day. All right, moving on to our second pillar. A patient's condition can change in a split second, and a lot of the time there aren't any obvious signs. So how do healthcare professionals get a constant, reliable status update on what's going on inside the human body? The answer is vital signs. Honestly, you should think of them as the body's dashboard. Temperature, pulse, breathing, and blood pressure, those are the gauges that tell us exactly what's happening under the hood. And the crucial part is, they change immediately when something's off, which makes them the ultimate early warning system. So why is this constant monitoring so important? Well, it's about more than just a single number at a single moment. It's about creating a baseline for every person, right? It's about spotting those tiny little changes before they become a full-blown crisis. And it's about seeing how the body's responding to treatment. Every measurement is a critical piece of the puzzle. And this is a perfect example of how that data becomes something you can actually use. A blood pressure reading isn't just 2 numbers. It puts a patient into a specific category: normal, elevated, or hypertensive. A simple chart like this turns raw data into a clear diagnosis and a plan of action. It literally makes the invisible visible. This brings us to our third pillar, and this one deals with something a little trickier. I mean, we can measure temperature, we can measure blood pressure, but how on earth do you measure something as internal and subjective as pain? Well, first, you have to define it. Clinically, pain is an unpleasant sensory and emotional experience. And that definition is so important because it officially recognizes pain as a critical health issue, something that has to be assessed and managed just like anything else. So, how do you measure it? With these beautifully simple tools. For adults who can communicate easily, you've got the numeric scale from 0 to 10. But for children, or maybe for patients who struggle with numbers, there's the FACES scale. It is such an elegant and empathetic solution that turns a really complex feeling into a simple choice. And the real power is right there in the instruction itself. Ask the person to choose the face that best describes how he's feeling. That one sentence transforms a clinical assessment into a moment of real human connection. It's about listening, it's about giving the patient a voice, and making sure their experience is truly seen and heard. So let's bring these 3 pillars all together. We've got hand hygiene, vital signs, and pain assessment. What do they really represent when you look at them as a whole? They represent 3 core principles: vigilance, precision, and care. These are so much more than just items on a checklist. They are the fundamental actions that build trust between a patient and their caregiver. This is the quiet, consistent work that really defines modern healthcare and ultimately keeps us all safe. So the next time you find yourself in a healthcare setting, Just look a little closer. What unseen pillars of care will you notice now? What quiet acts of precision and vigilance will you suddenly be able to see? Because now you know exactly where to look.